Oral presentation of improving morale of bedside nursing in the intensive care unit. Throughout all of healthcare, there is a flow when it comes to morale. It can be challenging for nurses to stay positive and happy when the challenging circumstances arise. Nurses are the backbone of healthcare, and hospitals would not be able to function without them. Nevertheless, the situations the nurses are played every day cause the most ambitious, dedicated nurses to question their decision to enter a nursing career. Some of the reasons that can diminish morale can be disrespectful patients, horrible staffing conditions, seeing death constantly, and much, much more. Boosting nurses' morale can help save the ever-increasing nationwide shortage of nurses, as well as reduce stress and fatigue in an ever so difficult career. The question lies, how does one improve the morale of nursing in an ever-demanding field? At Portsmouth Regional Hospital, it is a level 2 trauma center in Portsmouth, New Hampshire. It is an acute care hospital and encompasses 234 beds that serve the seacoast of New Hampshire, Maine, and Massachusetts. It is one of the area's largest employers and only ACS verified level 2 trauma center in New Hampshire seacoast. Portsmouth Regional Hospital is the only seacoast comprehensive heart and vascular program, only 24/7 comprehensive neurosurgical and stroke clot retrieval and aneurysm coiling program for both ischemic and hemorrhagic strokes. It is a part of HCA's Healthcare Capital Division and one of the nation's leading providers in healthcare services. At the intensive care unit at Portsmouth Regional Hospital treats medical and surgical patients. That includes patients recovering from serious illnesses and complex surgeries. Since the ICU is not dedicated per specialty, for example, a SICU, a surgical ICU, or a MICU, a medical ICU, there's many different patient populations that encompass this 20-bed ICU. The team within the ICU is specialized in critical care. The nursing team composed of spectrum of nurses ranging from 30 plus years of experience to new graduate nurses. They all work together in supporting, educating, and assisting each other, especially since the unit only has registered nurses, no LNAs, licensed nursing assistants, or LPNs, licensed practical nurses. The ICU nurses are required to be smart, detail-oriented, and ever so vigilant. Within the department, there's 50 nurses ranging from full-time to per diem. The specific focus of engaging improving morale and fatigue of bedside nurses included the ICU. Due to the level of acuity of patients, different demanding specialties, high mortality rate patients within the unit, stress and fatigue can run rampant among nurses. Specific survey outlined below attempted gauging staff morale on how to reduce stress and fatigue. One factor or question was how to reduce your stress and fatigue at work. One of the nurses commented establishing teamwork mentality with new staff and travelers. Within the unit, it is common culture to help your coworkers because inevitably you will need their help as well. It can be frustrating as a full-time nurse in the unit when travel nurses come and make double what you're making and not willing to help in situations. New staff are taught in orientation to lend a helping hand because that is the culture of the unit. The surveys observe existing evidence of stress and overwhelmed feelings amongst bedside nursing staff. The problem that existed can slowly be changed with proper education, proper leadership, and emphasis on positive culture. The change is already occurring by hiring at least one LNA to help with nursing staff, and is an ongoing process the director is aware of, who has been trying to at least have a few LNAs permanently on each shift. Within the ICU, the leadership of the director is already making his mark by being a competent leader and helping when needed. He has effective communication and is consistent and meaningful. Changes that were implemented, including expectations of travel nurses, including setting firm expectations on how to provide care at this hospital and how we are a team. By implementing this expectation of travel nurses, it will help full-time nurses feel less stressed by having more help in improving quality of patient care. The strategy for improvement was start off with a quality improvement that we changed immediately, which is identified as setting expectation for travel nurses in the unit. Since travel nurses work so many different hospitals, and it's difficult for them to adapt to each unit's culture. Although the ICU, there are not many travelers, around 3 to 5 at a time. Implementing expectations is easier to do, as Staff nurse orients them to the unit for a few shifts to set the improvement cycles. Within the model of improvement cycle, expectations are set to attempt to accomplish boost morale and reduce fatigue. Educating travel nurses and culture provides opportunity for travel nurses to better mesh a full-time staff, as well as bring out positive influences. Results of the study from implementing set expectation from travel nurses and orientation include positive impact amongst the morale unit. By observing new travel nurses coming into the unit and going through orientation with different nurses, setting them the same expectation throughout the nursing orientation showed major improvement amongst teamwork and reliability amongst travel nurses. Variations within the data included different travel nurses from different areas around the country adapting and agreeing to orientation guide and expectations. In conclusion, the nurses in the ICU is not an easy job. It entails a mixed emotion seeing patients take their last breath from helping those recover from horrible accidents. The feeling of stress and fatigue and being overwhelmed is known by all, but does not go unnoticed by administration. Having a solid foundation of leadership can understand the difficulty between willing to jump in and help when needed becomes overwhelming. The data was collected to use and start a conversation to reduce stress and fatigue amongst ICU nurses. The project achieved its goal by helping process of travel nurses' engagement and orientation in the unit. By setting the expectations and accountability, reliability greatly increased the travel nurses, which lend them a helping hand. Staff nurses when needed. This project will sustain amongst orientation of the travel nurses and start more conversations about issues that were noted, including the continuing process of hiring more LNAs to help bedside nurses and providing support for acute traumatic experiences, and continuing the effort to provide excellent leadership. In conclusion, improving morale is an ongoing process which will hopefully reduce fatigue amongst bedside nurses and promote more efficient care by reducing stress in bedside nurses. Thank you.